Meet. Can you see my screen?
Yes po, Doc.
Yes, Doc.
See my screen? Okay. Okay, so today is not going to be a long, it's not going to be an official lecture. Today is going to be just an introduction. So we know what to expect um, in this course. So this course is small animal surgery, right? Is that right? Tama ba? Small animal surgery section 5, ano ba? 5B? 5B?
5A, Doc.
5A? 5A. Okay. Okay. So I'm going to give the same lecture to 5B tomorrow. Okay? Okay. So my name is Mervin Pahate and I'm an adjunct lecturer for TAU. And I handle 3 subjects. I handle small animal surgery, feline medicine, and also a clinical pathological conference. Okay. Okay. So we're going to have a few changes in our lecture. Okay, because the reason is I work full time. Okay, I run a vet hospital here in Australia, so I cannot follow the official schedule kasi yung mga teachers nyo dyan, that's the only thing they do. Pero ako kasi I run a vet hospital. So this is my proposed schedule for the Zoom class. When I say Zoom class, it means this is our class that's going to be live. So I'll be delivering the lectures live. So for 5A, and that's you, right? 5A? Pasensya na kayo, nalilito kasi ako minsan eh. So 5A is Tuesday 3 to 5 p.m. Okay lang yan?
Yes, Doc.
Okay. Yung 5B naman will be Tuesday 10 to 12 a.m. So sa umaga sila, sa hapon kayo. Kasi yung schedule niya is originally hapon, di ba? Tama?
Yes, Doc.
Okay. So now, ganito gagawin natin. Every time I deliver a lecture, I'm going to record it. Okay? And then I'm going to send the recording to you. So if you want to listen to the lecture again, you can listen to the lecture again. Kung meron kayong di naintindihan, you can listen to the lecture again. Now, another thing, I'm not going to repeat my lectures. Meaning, yung tinuro ko sa 5B nung umaga, hindi ko ituturo ulit sa inyo sa hapon. So what I'm going to lecture in the morning will be a different topic from the lecture in the afternoon. So, nakuha niyo ba ibig ko sabihin? Did you get my point? Hello?
Yes po, Doc.
Okay. So, magkaibang topics 'yon, ha. So, for example, sa umaga, I'll be lecturing on pre-operative planning. Sa hapon naman, I'll be lecturing about anesthesia. Okay? So, magkaiba. But the good thing is, because Zoom is recorded, I can send you the recording of that other lecture, or this is another option. You can attend both lectures. Halimbawa, you're 5A. Okay? Tapos, may available time kayo sa umaga. Pwede kayong mag-attend ng lecture ng 5B sa umaga kung gusto nyo, if you're available. Okay? Or, if you cannot attend that lecture, then I'll just send you the recording. Okay?
Yes,
Is that clear? Do you have any questions? Please ask questions. If there's something that's not clear, please ask questions. Okay, so if you have any other questions that you can think of after this lecture, make sure you email Jeriel. Jeriel, Can you hear me?
Yes, Doc.
Okay. This is what we're going to do, Jeriel. If anyone in the class has a concern, may question or may concern, ikaw ang point person ko, ah.
Yes, Doc.
Okay. So everyone, please remember, if you have any questions, if you have any concerns, please send it to Jeriel para isang tao lang ang kinakausap ko. Okay? However, in a lecture like this, you can ask me directly your questions. Okay, so let's move on. Okay, so learning medium. So how are we going to do this course? So we're going to do this course with live Zoom lectures. Okay. We also have recorded Zoom lectures. And also on October, may klase ba kayo ng October, yung before the All Saints Day, 30-31? Do you have classes?
Doc, meron po ata.
Hindi, kailangan ko sigurado kasi uuwi ako eh. Uuwi ako para mag face-to-face tayo.
Doc, meron po.
Meron kayong klase.
Yes, Doc. Kasi ang start po ata ng holidays dito is November 1 po.
Okay, so ganito gagawin natin. So, ang on the 30, ano ba yung 30? Kalimutan ko na.
Monday, Doc.
Monday. So, Monday and Tuesday, 30 and 31st, nandyan ako sa TAU. Okay, nandyan ako sa TAU. So, we will do all our labs when I get there. So, yung makakakuha ba kayo ng cadaver, dog cadaver? Or
Doc, I think sa October 30 po is election day po dito sa Philippines.
Ha?
Yes, Doc. Local election po.
Ano ibig sabihin nun?
Barangay election po, Doc. Per municipality po, Doc.
Barangay election.
Yes, Doc.
Okay. Nako, so hindi pwede. Hindi bale, basta I'll go home so we can have a face to face. Hindi ko lang alam kung anong, I just don't know which date. Pero it's going to be October, okay? It's going to be October, or it's going to be or it's going to be November. Let's see. Di sigurado. Okay. So do you have any concerns about the learning medium? Do you have any questions?
Wala na po, Doc.
Wala kayong questions? Okay, let's. Yes.
Doc, are we going to perform any surgery, Doc, this sem po?
Yes, when I get there. Pag
Okay,
umuwi
Doc.
ako, papakita niyo sa akin kung gaano kayo kagaling. Okay? We will do dalawa. Well, look. Pag naging vets kayo, ano ba ang mga kailangan niyong matutunan when you graduate? Ano ba ang kailangan na alam niyo na? Ang kailangan niyo lang namang alam is two basic surgeries. You need to know how to castrate a dog. And you need to know how to spay a dog. Yung female dog. Yun lang naman ang dalawang kailangan alam nyo when you graduate. The rest of the procedures, you will learn that when you start working. Yung mga exploratory laparotomy, orthopedics, all those things, hindi naman required na alam nyo yun when you graduate. What's required is when you graduate, you need to have an understanding, pero you don't need to know how to do it. Okay? So for our face-to-face workshop, what we need is we need live dogs for you to do your surgery. So how many are we? 30 how many?
38, Doc.
38. So how many students in one group? Anong ginagawa niyo?
Depende po sa bilang ng klase, Dok.
So halimbawa 37, pasensya ka na, hindi ko kabisado kasi. So
It's
for
okay,
example, for 37, mga 10 groups ba kayo? Tama ba? Is that accurate?
How many po per group, Dok?
Hindi, kung halimbawa, well, it's either 3 or 4 eh. So kung 3 kayo, kung 3 per group, then you'll have 12 groups. Tama? Tama ba?
Yes, Dok.
12 groups kayo. Oo. Kanyan, that's one section, ha? That's one section. 12 kayo. So maghapon na yan na workshop for us. Oo. Kasi I cannot do 2 sections in one day. Mahirap 'yon, di ba? So, do you have access to a spay kit? Hello?
Dok,
Yes.
what do you mean by spay kit, Dok?
Yung spay kit, yung gagamitin nyo pag nag-B-sex kayo.
Ay.
Kit.
Dok, we have surgical tools na, Dok.
May surgical kit kayo. Yung mga Metcham bomb, yung mga ganon, hemostats, meron kayong ganon.
Yes, Dok.
Okay. Yun ang kailangan nyo when you do the surgery. And also, you need to get live dogs. Healthy live dogs. Tapos, as much as possible, yung dogs nyo is heartworm positive. Heartworm positive dogs. Heartworm positive. Heartworm negative pala. Fully vaccinated with C3 and also rabies vaccine. So, wag kayong gagamit ng dogs na walang rabies vaccination, okay?
Dok, if ever po, sa groupings, Dok, last time po, we have groupings na po that has 5 to 6 members, Dok.
Ang dami, So, ilan yun? Ilang groups yun? Mga 8?
6 to 7, Dok.
7 groups. O, pwede yan. Sige. Pwede. Pero, ang gusto ko sana, what I want is lahat kayo masubukan nyo mag-spay.
But it's all depends on you, Dok, if ano po yung decision nyo.
Hindi, okay lang sa akin. Para hindi magulo, we can use that group. So, sino to? Jeriel, ikaw ba to?
Yes, Dok.
Okay. Ipadala mo sa akin yung groupings.
Okay, Dok.
Okay? Marami ka na assignment.
Opo, Dok.
Marami ka na assignment sa akin. Padala mo sa akin yung groupings para kasi I'll give you cases to present online too. Okay? So, based sa groupings nyo. Okay, so ano pa? Any more questions about our learning medium? No more questions?
Dok, as of now, wala na po siguro, Dok.
Okay. Sige,
Any message na lang po, Dok.
Okay, so basta Jeriel, you send me the feedback if anyone has a question.
Yes, Dok.
Okay, next one. What's our next? So topic coverage natin, this will be based on the curriculum. So I made okay. Okay, let's try. Okay. So let's try a case. Okay? Let's try a case. So let's try this case. So this is Coco. So Coco is a 2-year-old male Chihuahua, not desexed, fully vaccinated, fully wormed. So what happened with Coco is Coco started to vomit. Okay, vomited several times today and vomited food and bile. Okay. So what do you think? What's the next thing we need to do?
CBC, Doc.
CBC. CBC, okay. Okay, so complete blood count, normal. Ano pa? Oh,
And
why do you need to do a CBC? Jeriel, hindi lang ikaw ang sasagot ha. The whole class should be answering. So why do we need to do a CBC? Para saan ba yun? Why do we need to do it? What is CBC measuring?
Doc, the blood components, Doc.
Yep. So in the blood components, what are you trying to look at? What part of the blood component?
Doc, the red blood cells, the white blood
Red blood
cells.
cell. Okay. Let's focus on the red blood cells. What do you want to know about the red blood cells? What do you want to know? What is the basic? If you want to look at the red blood cells, what's the basic thing you want to know? Just focusing on the red blood cells. Ano ba gusto mo malaman if you're looking at the red blood cells?
Doc, if enough po ba yun?
Okay, you're tama. Okay, enough. Anong tawag doon? What do you call if the red blood cells is not enough? What do you call it?
Anemia, Doc.
Anemia. Okay, so you want to know if the dog's anemic. What else? What else are you going to look at aside from the red blood cells?
The white blood cells, Doc.
The white blood cells. And why? Why do you want to look at the white blood cells?
To check if there's any infection, Doc,
All
or
right,
any
infection. So basically, you want to know if there's an infection, and you want to know if the dog's anemic. Um, so, so the answer to that question is Coco is not anemic and Coco has no infection. Okay. What else? Is there any other blood test you want to do?
blood chem, Doc.
Blood chem. Okay. So ano ba ang blood chem? So blood chemistry, biochemistry measures kidney enzymes, liver enzymes, electrolytes, lipase, lactate. So lahat 'yan measures, tama? Okay. So when a dog has a liver problem, nagsusuko ba 'yung aso?
Yes, Doc.
Yes, tama. So you need to rule out if there's a liver problem. So the test says Coco has no liver problems. How about kidney problems? Will the dog vomit if there's kidney problems? Kung may kidney failure, will the dog vomit? Anong hula nyo? A dog with kidney failure, nagsusuko ba yan? May nag-chat. Ano nakasulat dito? If you can answer me through chat, okay? If you want. What do you think, class? What do you think? What do you think, guys? If there is kidney failure, will the dog vomit? Is vomiting one of the presenting sign of kidney failure?
Possible, Doc.
The answer is yes. Yes, it's a sign. Because if the urea is up, it will vomit. Okay? Okay. How about electrolytes? If there's any electrolyte abnormality, will the dog vomit?
Yes, Doc.
Yes. So nakakalito na, no? Lahat yan, all those things can cause the dog to vomit. Okay. How about pancreatitis? If the lipase is elevated, will the dog vomit? Yung may
Yes,
pancreatitis,
Doc.
oh yes. So kidneys, liver, electrolytes, pancreatitis, infection, all those things can make your dog vomit. That's why you need to rule that out. You have to make sure that that's not a cause for the vomiting. Now, let's go back to Coco. Lahat siya normal kay Coco. Everything's normal. So the bloods are all normal. What's next? Okay, so that's the blood. Okay, so that's, can you see it?
Yes, Doc.
Okay, so that's the blood. Okay, hematology, everything's normal. Okay. Everything's normal. Everything's within range. So this one is okay. Hindi okay lang yan. Yung MPV, that's not significant. Biochemistry. Okay. Glucose is normal. SDMA is normal. SDMA is a measure of kidney function. Okay. So normal yung creatinine is normal. Urea is normal. Electrolytes are all normal. No problem. Okay. Um, ALT, ALP, GGT are all normal. Bilirubin is normal. Cholesterol normal. Amylase, lipase, everything's normal. So if the blood's normal, dog's vomiting, what's next? What's next? Ano ba pwede natin gawin? Kasi still, we don't know why the dog's vomiting. Tama? We don't know.
Yes, Doc.
We don't know. So hinahanap, we're trying to find the reason why the dog's vomiting. So we've done bloods and the bloods are normal. What else can we do?
Is it possible, Doc, endoscopy?
Uh, yes, it's possible. Yeah, it's possible endoscopy. But before doing that, what can you do first? Before that's very advanced imaging. Kasi endoscopy, gastroscopy, for example, you can only go as far as the stomach. Tama?
Yes, Doc.
Oh, hindi ka naman sosobra sa stomach eh, kasi maikli lang yan eh. If the problem is in the stomach, then yes, you will see the problem. But what if the problem is more caudal, like in the intestines? You,
X-ray or
okay,
radiograph,
okay. So
Doc.
tama, X-ray. So X-ray and ultrasound. Okay, so X-ray natin. Ano nakita natin? What can we see? Can you see the X-ray?
Yes, Doc.
So what can you see? So looking at the X-ray, it's very obvious. All the arrows are pointing into the object. What can you see? Can you see anything on the X-ray that's obvious? Okay, so you can see a foreign body. Can you guys see that?
Yes, Doc.
Okay, so there's a foreign body. So all the bloods are normal. There's a foreign body. Um, can this foreign body cause vomiting?
Yes, Doc.
Yes, of course. Yeah. Because the foreign body can cause obstruction, and the obstruction will prevent food from going into the GI tract. So what will happen? Lahat ng kinakain niya will stay in the stomach, and what will happen with that? It will just come out to the esophagus. Okay? Is this an emergency?
Yes po, Doc.
Yes. Do you need to do surgery?
Opo, Doc.
Opo, tama. So, kailangan mag-surgery. Ngayon, the question is, kailangan mo bang, do you need to do the surgery right now or you can do it tomorrow? Halimbawa, ako yung kliyente. Nako, meron palang nilulun na what do you call this? Stone, bato yung aso ko. So, kailan nyo, Doc, ooperahan? So, ano ang sasagot nyo?
Doc, I think it is a emergency case, Doc. So, as soon as possible.
Okay, so the way you answer it is like this. Okay, so it really depends on the condition of the dog. Okay, so if the dog is very very sick, then you have to do it right now. Okay, if the dog is very sick, then you have to do it ASAP, as soon as possible. If the dog is happy, because most dogs, karamihan ng mga aso na may foreign body are happy. Masaya sila. Nagsusuka lang sila pero they're very happy. Yeah. So in that case, you can do it the next morning. You can do it the next day. And what is the surgery that you're going to do? What do you call the surgery that you're going to do? What's the procedure? Okay, so you're going to do an exploratory laparotomy. So you need to, if you open the abdomen of the dog, you don't just remove the foreign body, but you also check everything. You check the liver, you check the kidneys, you check the intestines, because you might be missing another problem. Baka inalis mo lang yung foreign body, yung pala yung aso merong cancer, hindi mo nakita. No? Dahil hindi mo siya in-explore. Okay? So what I want you to understand in this exercise is most of the surgical cases that you're going to see in practice, hindi naman lahat yan surgery agad eh. Dumadating yan in your clinic na ang sasabihin lang na may-ari sa inyo, yung aso ko nagsusuka, yung aso ko kumakain, yung aso ko hindi kumakain, or minsan, yung aso ko, yung front leg niya hindi niya maiapak. Yeah, ganun lang. So hindi niyo pa alam if there's any surgical intervention that you can use. So it all starts, you need to have a process in when you diagnose cases. You need to start with the history. Okay? History is ano nangyari? Ano nangyari sa aso? Kailan nagsimulang magsuka yung aso? Ilang beses? How many times a day? What's the appearance of the vomit? So lahat yan, you have to ask that question. The next is signalment of the dog, meaning, how old is the dog? Is the dog D6? Anong pinapakain nyo sa aso mo? Is the dog a chewer? Naintindihan nyo ba yung ibig sabihin ng chewer? Do you understand the meaning of chewer? Can you guys hear me?
Yes, Doc.
Do you understand the meaning of chewer? Chewer, yung mahilig siyang matngat na mga lubid, o mahilig meron siyang palagi niyang inangat-ngat yung mga laruan niya. Kasi when dogs do that, they can swallow foreign body, no? So mahilig kumagat ng kahoy or whatever. Mahilig kumain ng medyas, yung mga ganun. Oh. So lahat yan, all those things are important to know all the history. And then the third thing is, so you need to do the history, you need to know the signalment. Third, you need to examine the dog. You need to examine the dog from the tip of the nose to the tail. You need to check the mucous membranes, temperature, weight, heart rate, respiration, may pain ba sa abdomen. You have to do digital examination of the rectum. I-check nyo. Baka yung kanyang prostate is swollen or baka constipated yung aso. So you have to do a very thorough check of the dog. And then after that, you need to do possibly, if you think you need to do bloods, you need to do bloods, If the bloods are normal, you need to do imaging. And then by that time, hopefully, you'll know the problem of the dog. Okay? So like our case for today, the dog has swallowed a foreign body, it needs to go and get an exploratory laparotomy. Okay. Now, do you have any questions about the case? So class, when I ask you to present a case, you need to have a history, signalment, examination, bloods, what else? Imaging kung kailangan. And then after that, after you've done all of that, the last one is you need to have an assessment. Ano sa tingin nyo ang problema? And then anong solusyon? What's the treatment for the problem? So that's how you present the case to me. Okay? Any questions?
Ano po yung foreign body na nasa loob ng aso?
It's a stone.
Oh.
So, ang mga chihuahua kasi gusto nilang lumulo ng bato. Any questions? May nakabukas ang mic sa inyo. Sino? Okay. Any questions? Any more questions about the case? Okay, so let's move forward. Okay, well, let's move forward. Okay. So let's talk about the schedule of activity. Okay, what are we going to do? What are we going to do in this course? So the timelines. Okay, so we're already late. So August 22nd is the start of classes. But anyway, we'll catch up. No problem. And the midterm exam will be on the 17th and the 17th to 20 of October. So I'm not sure kung ano yung schedule nyo. I will send the exam and somebody will deliver the exam. Then tentatively, this is not confirmed yet. Tentatively, we're going to do the face-to-face on the 30th or the 31st. Pero if that is the election, we have to change that. Okay, we might do it later. We might do it on early after the holidays. We might do it. Okay, and then the final exam will be on the 5th and the 8th of December. Okay. Okay, so the schedule of topics. So for this week, I'm going to do an introduction. Okay, so we're going to do an introduction. So we're already doing it. Okay, September 11 to 12, we're going to deal with neurosurgery. Remember, all these topics comes from the new curriculum. Have you heard about that? There's a new curriculum.
Yes, Doc.
Yeah, there's a new curriculum. So this is based on the new curriculum. I don't really agree with it, but that's the curriculum. Because number one, you don't really need to know neurosurgery because that's very advanced. You don't really need to do that. But anyway, we'll talk about neurosurgery next week. So September 11th to 22nd, neurosurgery. September 25th to October 6th, we're going to focus on orthopedic surgery. So midterm is on the 17th. I'm not sure, 17th to the 20th. I'm not sure what date. The coverage of the midterm will be neurosurgery and orthopedic surgery. Right? Then October 9 to 20, surgery of the ears, mouth, and teeth. October 23rd and November 3, surgery of the digestive system. November 6 to 17, surgery of the repro system and genitourinary system. November 20 to 24, surgery of the respiratory system. And October 27 to December 1st, surgery of the integumentary system and cardiovascular system. And then on the 5th to the 8th of December, we're going to do. So you're not graduating, right? Are some of you graduating?
Not yet, Doc.
Not yet. Okay. Because there's two schedules. So the December 5th to 8th is the final exam for those who are graduating. Tama?
Yes, Doc.
Pero yung non-graduating, later on December, kailan yun? December 15 yata. Tama ba? Do you remember? So if we can extend the lectures anyway. Kasi if you'll see the surgery of the integumentary system and cardiovascular, medyo ipit yung oras natin. But if you're non-graduating, we can extend the lecture. Okay. So for the finals, it's going to be a longer coverage. For the final exam, it's going to be surgery of the ears, mouth, and teeth, surgery of the digestive system, surgery of the reproductive genitourinary system, surgery of the respiratory system, surgery of the integumentary system, and cardiovascular. That will be the coverage of the final exam. Okay?
Yes, Doc.
All right. So any questions? That's actually the end of today's meeting. Do you have any questions?
Doc, about the groupings, Doc. Is it okay, Doc, to have 6 members per group, Doc?
Yeah, that's fine. That's
Okay.
fine. You just send me the old groupings that you have. Send it to me.
Yes, Doc. So based on our numbers, Doc, we have 37. We are 37 in total. So is it okay, Doc, to have 7 members in one group? Sa isang grupo lang, Doc.
It's okay to have 7 members in a group, but you have to have 1 dog per person.
Ah,
Siyempre, di ba lahat kayo magsa-surgery?
so in a group, Doc, even we are 6 members, kailangan, Doc, may isa-isang aso.
Isang aso. Isa lang naman isa lang naman. Well, isa lang aso. Tapos half of the dog will be male, half of the dog will be female. Okay?
So every student, Doc needs to bring one.
1 dog.
Yes, Doc.
And this is going to happen when I go home. Pag nagkita-kita tayo.
So it's like a solo surgery, Doc, pero with the help of the members na lang, Doc.
Oo. So the members, so each one will do a surgery. Di ba may bago kayong vet hospital?
Yes, Doc.
Ano, open na ba? Hindi pa.
Hindi pa po operational, Doc.
Pero sa sa October kaya operational na.
Hindi ko lang alam, Doc. Pero open na po siya, Doc.
I'll ask I will ask Sino ba 'to? Si Dr. Loves. Kasi siya yata ang hospital superintendent niyo, di ba?
Di ko lang sure, Doc.
He's the hospital superintendent. Okay. Okay, so any questions, class? Any more feedback, questions? Okay, so I'm just going to go back while you're thinking about your questions. Just going to go back. So your next lecture will be Tuesday next week, 3 to 5 p.m. Okay?
Yes, Doc.
Okay. So that's the live lecture. And then I need the what do you call this? I'll stop sharing. Stop share. Oh, okay, so I'm going to Jeriel, so you're going to send me the groupings. Okay? You're going to send me the groupings, and then you're going to send me the feedback, and then you're going to send me the emails. Okay?
Yes, Doc.
So I need the email so I can send you the PDF copy of the book. Okay, I'll send you the PDF copy. Okay. So
Okay, Doc.
any other questions? If you have no more questions, that's the end of the lecture. And then I'll see you next week.